In recent years, research has really started to understand the connection between gut health and brain health. Today, we're going to look at the gut-brain axis, which we do have other videos on, but we're going to look at it from a new perspective in terms of cognition. This exciting two-way pathway that allows for communication between the gut and the brain may lead to insights and possibly treatments for Alzheimer's disease. So in this video, we're going to talk about Alzheimer's disease, the gut-brain axis, and how fecal microbiota transplantation might be a potential therapy for Alzheimer's disease. We all know that the gut plays an important role in digesting food, but did you know that the gut microbiome plays an important role in brain health? There's increasing scientific literature that shows that the gut microbiota are not only important for gut functioning, but also brain function and development. We know that different microbiota compositions actually impact both behavior and cognition. And this has led people to think that maybe the gut-brain axis may be an important factor in neurodegenerative diseases like Alzheimer's disease. So while we know the gut-brain axis is important, what exactly ties it into Alzheimer's disease? Alzheimer's disease is a complex puzzle that we do not understand, but it's possible that one piece of this puzzle is the gut microbiome and the gut-brain axis. Alzheimer's disease is the most common form of dementia. It's characterized by abnormal protein accumulation within the brain and cognitive decline. The composition and diversity of the gut microbiome in patients with Alzheimer's disease is distinctly different. And these changes are aligned with other neurological conditions, which seem to have a clear role of the gut microbiome, like Parkinson's disease and multiple sclerosis, which we do have other videos on. So seeing a change in the composition and the functioning within the gut microbiome in Alzheimer's disease patients has led people to ask if the gut microbiome might be a key in part of treating Alzheimer's disease. Now, here's where I think the science gets really exciting. The ability to alter the gut microbiome using fecal microbiota transplantation is a new area of interest for treating Alzheimer's disease, as changes in the gut microbiome may be tied to the development and progression of the disease. Fecal microbiota transplantation, or FMT, or sometimes known as a stool transplant, is the process of taking a healthy gut microbiome from the stool of a donor and transplanting it into a recipient to alter the gut microbiome. While this may sound unusual and some would even say unorthodox, it's definitely a treatment that's gaining traction across the board, from gut-related disorders to, neurological disorders like Parkinson's disease and Alzheimer's disease. So why are we talking about FMT in terms of Alzheimer's disease? As the scientific community learns more about the gut microbiome, the gut-brain axis, and the connection between neurological disorders, the possibility of FMT as a novel treatment avenue for Alzheimer's disease has increased. While to date, most of this research has been done in animal models, some early human studies have shown some promising results. Actually, two really exciting new case studies have come out showing rapid improvements in Alzheimer's disease in terms of mood, cognition, and microbiome diversity, which has been really important, really exciting, and has led people to really, I think, invest in looking at FMT, gut modulation, and Alzheimer's disease. So while what I've highlighted here is really exciting in terms of FMT as a potential treatment for Alzheimer's disease, we need to remember this is a new field of study. We don't really understand the optimal procedures, the long-term outcomes, the safety, and we need large-scale clinical trials to fully understand if FMT is the potential treatment we think it might be. But to say I'm excited is an understatement, and any growth in better understanding Alzheimer's disease is, a win in my book. As we continue to peel back the layers of how the gut microbiome impacts within our whole body, the gut-brain connection is really adding some interesting avenues of research into understanding its role and potential treatment within neurological conditions like Alzheimer's disease. The exact mechanisms the gut microbiome plays in Alzheimer's disease is something we don't understand yet and is currently being researched. But FMT as a potential treatment is an exciting area of research. While new, the results are really promising. But as we dive deeper into the scientific journey, we need to approach with cautious optimism. While FMT may be a revolutionary treatment for Alzheimer's disease, we need more research, we need more clinical trials, and we need to understand the long-term outcomes and the safety of FMT as a potential treatment. Thank you so much for watching. If you want to read more about this topic or know where this information comes from, check out the link in our description to our blog. And if you want more gut health tips or are just interested in the gut microbiome in general, follow us on social media or check out our other videos.